Did you see that news story about the person who died in Iowa from Lassa fever?
Yeah, it's pretty surprising, right? A disease we usually think of as being way over in West Africa showing up in the Midwest.
Exactly. So today we're going to do a deep dive into Lassa fever.
Sounds good.
We'll look at what it is, how it spreads, and what this case in Iowa means for, well, for everyone.
I think a lot of people are going to have questions about this one.
For sure. So maybe we can start with the basics. What exactly is Lassa fever?
Okay, so Lassa fever is caused by a virus, and it spreads through contact with infected rodents.
Rodents, okay. Like, rats.
Yeah, specifically, it's a type of rat called the multi-manate rat.
Multi-mant rat, huh? Never heard of that one.
Yeah, they're common in West Africa, and they contaminate food sources with their urine and droppings.
So someone eats food that's been contaminated, and that's how they get infected.
It is. Though it's not just food, touching contaminated surfaces can also transmit the virus, and even sometimes inhaling tiny particles from those droppings.
So it's pretty easy to catch.
If you're in an area where those rats are prevalent.
Right. Which brings us to this case in Iowa. The person who died got infected during a trip to West Africa.
Right. So they were traveling in an area where the virus is common, and they got infected over there.
But now health officials in Iowa are monitoring people who had close contact with this person. Should Iowans be worried?
Well, the CDC is confirming the diagnosis, and, health officials always want to be careful and monitor people, but realistically, the risk of transmission within Iowa is incredibly low.
So you're saying even after this case, people in Iowa don't really need to worry about Lassa fever?
I am. In fact, you are much, much more likely to be struck by lightning than to get Lassa fever in Iowa.
Okay, that puts things in perspective. But I think people still want to know, how contagious is this virus? I mean, how does Lassa fever spread from person to person?
That's a good question. Lassa fever isn't airborne, so you're not going to get it from just being in the same room as someone. Casual contact, like hugging or shaking hands, won't spread it. You would have to have direct contact with an infected person's bodily fluids after they develop symptoms.
Okay, so it's not like as contagious as measles or the flu or something like that.
Right. It's not as easily spread.
Now, the news articles I read said the symptoms of Lassa fever can be pretty varied. Is that true?
Yes, that's one of the tricky things about this virus. The symptoms can vary a lot. And here's something that might surprise you. 80% of people who get infected with Lassa fever don't have any symptoms at all.
Seriously, they have no idea they even have it.
Nope, they're totally fine. They might not ever know they were even infected.
Wow, that's crazy. But what about the other 20%? What kinds of symptoms do they get?
Well, symptoms usually appear about a week after you're infected, and the symptoms, like I said, they vary.
Right.
It could be something as mild as a fever and a headache, or in more severe cases, you could have bleeding.
Bleeding. Internal bleeding.
It can be. Or it can be from your gums or nose.
Yikes. Okay, what else?
Trouble breathing, vomiting, pain in the chest and back.
So it sounds like it can be pretty serious.
It can be for some people.
So if someone does experience these symptoms, what should they do?
If someone has these symptoms and they've recently traveled to West Africa, they should definitely see a doctor right away.
Okay, what about treatment? What's the treatment for Lassa fever?
Well, there's an antiviral drug called ribavirin.
Ribavirin, okay. And that's effective.
It is if it's started early enough, and thankfully the overall fatality rate is relatively low, around 1% globally.
That's good news, at least.
It is.
I guess the main takeaway here is that although the chances of getting Lassa fever in the U.S. are very, very slim,
Very slim.
it's still important to be aware of it.
It is. And this recent case in Iowa, I think it shows that infectious diseases don't really respect borders.
Absolutely. Global travel has made it so much easier for diseases to spread all over the world.
Exactly.
And that's especially important to keep in mind for anyone who's planning to travel to places like West Africa, where Lassa fever is more common.
I agree. Being informed is so important.
It really is. So that the next time you're getting ready for a trip overseas, do your research.
Yeah, I think this whole situation with Lassa fever in Iowa really highlights something that we all need to think about.
What's that?
Well, we've got increasing global travel. More and more people are traveling all over the world. And it makes you wonder, how can we balance individual freedom with the need to keep everybody safe?
That's a great question. And I think it's one that we're going to be grappling with more and more in the years to come.
Definitely.
Well, that's about all the time we have for today.
Great talking to you.
Yeah, you too. We'll see you next time for another deep dive.
See ya.
Bye.